A doctor once assured a room full of grieving parents that a new sleeping pill was so safe it could be given to a child. That same drug went on to leave more than 10,000 infants with missing limbs, and thousands of them never made it past their first year. It wasn't the deadliest failed experiment in history, not by a wide margin. Every case on this list started the exact same way: a genuine problem, a confident solution, and a room full of experts who either didn't look closely enough at what they'd built or looked away on purpose. This is a story of 4 experiments, each one meant to fix something that ended up creating something far worse than the problem they set out to solve, counting up from bad to almost unimaginable. Number 4. In 1917, in a factory in Orange, New Jersey, young women line up for one of the best jobs available to them: painting luminous numbers onto watch dials with a glowing new substance called radium, earning nearly 3 times the wage of an ordinary factory job. Their supervisors teach them a simple trick to keep their bristles fine and precise: point the bristles between their lips before every stroke, a technique known as lip pointing. Radium, they're told, is perfectly safe, even beneficial, marketed elsewhere as a tonic for vitality and health, sold in tablets and tonics that wealthy men drink believing it will extend their lives. The women paint their nails with it for fun on their nights off, and some even paint their teeth to surprise their husbands with a glowing smile in the dark on the walk home. Within a few years, a strange illness starts moving through the factory floor. Teeth loosen and fall out on their own, one by one, with no obvious cause. Jaws swell, then begin to visibly rot away beneath the skin, a condition doctors eventually name radium jaw. A young woman named Grace Fryer watches her own jaw disintegrate before doctors finally connect her symptoms to the job she'd taken with so much pride 6 years earlier. By 1927, more than 50 of these dial painters have died, poisoned from the inside by an element their employer knew was dangerous and their government hadn't yet learned to fear. The radium sat inside their bones for the rest of their shortened lives, radioactive enough that decades later their graves could still be measured with a Geiger counter clicking steadily over the soil. Radium was sold as a miracle. What came next was sold as a cure for suffering minds, delivered with an instrument that looked more at home in a toolbox than an operating room. Number 3. In 1946, at a medical office in Washington, D.C., a psychiatrist named Walter Freeman perfects a procedure he believes will finally offer relief to patients trapped by severe mental illness, patients whom the medicine of the era has almost nothing else to offer beyond padded rooms and restraints. He calls it the transorbital lobotomy. Freeman has no surgical training and doesn't believe he needs any. He simply lifts a patient's eyelid, positions a thin metal instrument that resembles an ice pick against the bone at the top of the eye socket, and taps it through with a small hammer until it reaches the brain, then sweeps it side to side to sever the connections in the frontal lobe, sometimes asking the patient to count backward or sing a favorite song so he can judge, in real time, exactly when to stop. He performs his procedure in his own office, sometimes without anesthesia beyond a jolt of electric shock to render the patient briefly unconscious. Word spreads fast. Families desperate for any answer for a struggling relative start lining up, including the family of a young woman named Rosemary Kennedy, whose father brings her in for the procedure in 1941, hoping to calm her mood swings and headstrong temperament. She leaves unable to walk properly or speak more than a few words for the rest of her life, institutionalized for the following 60 decades. Freeman goes on to perform an estimated 3,500 of these operations himself over the following decades, traveling from state to state in what colleagues nicknamed his lobotomobile, performing dozens in a single week at state hospitals with no operating theater at all. By his own estimates, roughly 490 of his patients died directly from the procedure. Thousands more were left permanently altered, some reduced to a childlike state, unable to care for themselves for the rest of their lives, staring blankly at rooms they no longer fully recognized. The man who pioneered the underlying surgery had won the Nobel Prize for it. Freeman kept performing his version of it until 1967, when one of his patients died on the table from a hemorrhage and authorities finally banned him from practicing. A tool built for the mind ended up erasing the very people it was supposed to heal. What happened next targeted something even more fragile, a child still forming inside its own mother. Number 2. In the late 1950s, a German pharmaceutical company releases a new sedative, marketed as so gentle and so safe that it becomes available without a prescription in dozens of countries, advertised as harmless enough for anyone, even children, to take without risk. Doctors soon start recommending it to pregnant women to ease morning sickness, reassuring them there's no safer option on the market, a claim repeated in advertisements and by trusted family physicians alike. What none of them yet understand is that the drug crosses directly into the developing fetus, and depending on the exact day of pregnancy it's taken, it can interrupt the formation of limbs, ears, eyes, and vital internal organs at the precise moment those structures are supposed to be growing. Babies begin to be born with shortened or completely missing arms and legs, their hands sometimes emerging directly from their shoulders, a pattern of malformation doctors had almost never documented before at this scale. In one American office, a newly hired reviewer named Francis Kelsey refuses to approve the drug for sale in the United States, insisting the company's safety data simply isn't strong enough, holding her ground for over a year against enormous pressure and repeated visits from the manufacturer's representatives. Her refusal spared the United States from the worst of what unfolds elsewhere. This was thalidomide, and by the time it's finally pulled from shelves worldwide in the early 1960s, more than 10,000 babies had been born with severe malformations caused by the drug, and researchers estimate that close to half of them die within their first year of life, their tiny bodies unable to survive alongside the internal damage the drug have already done before they ever took a breath. And yet, even that tragedy, measured in thousands of lives, is dwarfed by an experiment still unfolding today, one that began with a single promise printed on a pill bottle. Number 1. In 1996, an American pharmaceutical company releases a powerful new opioid painkiller, marketed directly to doctors with a claim that would turn out to be catastrophically false, that the drug's slow-release formula makes it virtually impossible to become addicted to. Sales representatives fanned out across the country, visiting physicians' offices with charts and studies funded by the company itself, encouraging doctors to prescribe the medication freely for even moderate everyday pain, from backaches to routine dental work, treating pain relief as a right rather than something requiring caution. Patients trust their doctors, doctors trust the company's data, much of it later revealed to have been misleading or outright fabricated. Within a few years, addiction rates began climbing in exactly the working-class communities where the drug had been marketed most aggressively. Small towns where a single pharmacy sometimes filled more opioid prescriptions in a year than there were residents. When prescriptions eventually run out or get harder to refill, many of those same patients turn to heroin and later to an even deadlier synthetic opioid called fentanyl to keep the withdrawal at bay. A substance so potent that an amount smaller than a few grains of salt can be fatal. This was OxyContin, and the epidemic it helped ignite has gone on to kill more than 700,000 people across the United States and Canada since the late 1990s, a death toll that continues to climb every single year, touching small towns and major cities alike, leaving behind children raised by grandparents and entire communities hollowed out by a single deliberately dishonest sentence about a pill bottle's safety. 4 experiments, 4 different decades, one repeating pattern. Something genuinely new promoted by people who either didn't fully understand the danger or chose not to look closely enough for it, unleashed on people who had no reason not to trust the experts telling them it was safe. A miracle element that ate through jaws and bone while its own manufacturer knew the risk, a surgical fix for the mind that erased the very personality it claimed to treat, performed by a man with no license to operate, a gentle sedative that reached into the womb and stopped a body from finishing what it had started, waved through with almost no real testing, a painkiller sold on a promise its own makers knew wasn't true, repeated to doctors who had every reason to believe them. Each one began as an honest attempt to solve a real problem that people were genuinely suffering from, and each one ended up creating something far more devastating and far longer lasting than whatever it had originally set out to fix. If this video moved you the way it was meant to, hit like. That's the clearest signal that tells us to keep telling stories like this one instead of something easier to watch. If you know someone who needs to sit with this the way you just did, send it their way. That's genuinely how a small channel like ours finds new people who care about this kind of history. And down in the comments, tell us which of these 4 hit you hardest, or which failed experiment you think belongs on this list next. We read every comment, and they shape exactly what gets made.